Thanks for joining us, everybody. It is my pleasure to be your host today. My name is Michael Lesnik. I am the VP of Provider Sales here at Inferscience, and thanks for joining us for another episode of Care Decoded. I'm joined today, as usual, by our CEO at Inferscience, Dr. Sunil Nihalani. He's also a practicing physician. And today we're going to be talking about care gaps. I've been in healthcare IT and value-based care for the better part of 15 years, and care gaps are a really important aspect of clinical care, also revenue capture, but they're a pretty tricky thing for a lot of providers to handle appropriately. So we've got some questions for you, Sunil, to pick your brain and get some of your expertise on the topic, because I know it's something you live with day in, day out, both as a provider and as the CEO of Inferscience. So thanks for taking some time.
Thank you. Thank you for the nice intro. Yeah, let's get started.
Okay. So first question for you, really related to kind of your personal mission and motivation. So as a physician, how did you first experience the concept of care gaps? Was it, just a list of check boxes in the EMR that you had to address, or, did it really impact how you ever treated a patient at a visit?
Oh yeah, I mean it definitely impacts how you treat patients. So the concept of care gaps has been around since last, I don't know, 15, 20 years since we got Medicare Advantage, and even with Medicare, a lot of emphasis on prevention, right? But preventive care was always something important, right? So we used to call it preventive care then. So really, care gaps is just another sort of iteration of that or name for that. So patients, we've always tracked has the patient, if they're in the right age group, have they had the mammogram, have they had colon cancer screening, prostate, things like that. So yeah, it's something that I've known since I've been in practice, and how we have tracked it has changed over time. Obviously, we used to do it on paper charts, but every chart had a sheet in the front where all these measures were there, and you check them. And now we do it in the EMR. And now, obviously, we have people in the office who are totally focused on care gaps and HEDIS. So, yeah, in that sense, things have changed.
Yeah, great. And you bring up the colonoscopy. I'm coming up on 45, so I'm not looking forward to that one, but I'll be having that conversation with my doctor very soon, I'm sure. So thanks for that. So you've said before that closing gaps it's not just about meeting metrics, right? It's sort of about honoring moments of opportunity when you're actually caring for a patient. So could you expand on that a little bit?
Sure. Yeah. Yeah. It's definitely not about just meeting metrics, right? It's about really providing optimal care to patients. Yeah, and I will say that compared to a lot of countries in the world, we are fortunate in this country. We have so much emphasis on prevention, whereas a lot of countries it's not, and because they don't have the resources. But regardless, so meeting the moment, what that basically means is that your best opportunity of getting something done, getting the patient to schedule or convincing them that they need something is when they're in the office, right? So that is the moment that you have to catch. And, it can be a bit of challenge because, patient is there with their list of issues that they have, which are not prevention related necessarily. But at the same time, they're in front of you. So you have to meet that moment and make sure you address it. And as we'll discuss further, explain to them why it is important for them to have that particular test or intervention in their best interest.
Yeah, that makes total sense, right? Once they've left the office, it's too late to do something about that. Okay, great. So we sort of covered, right? It's not just about, HEDIS scores and checking a box. There is actually a basis for improved care in
Yeah.
closing these quality gaps. So it's really a twofold thing, right? There's some financial incentive, but there's also just good patient care. So, let's be honest, let's talk about why these care gaps continue to persist. Even though the data is right in front of us, right? The EMR is supposed to help us close these care gaps at the time of visit. What's broken in the workflow? Why are they not always closed?
One reason is that something that may appear to be straightforward on a checklist, right? Did this patient have a colonoscopy? One challenge is that the right data has to be surfaced at the right time, right? In front of and accurate data. So happens all the time that we get something from the insurance company. Patient needs such and such measure, right? Needs an eye exam or needs a mammogram or whatever. And then, you start digging in and turns out the patient just had it in the last, year, within the last year, right? So that's where it becomes a bit of a data issue that you don't have the correct data. Secondly, for the patient, it's a completely different experience, right? There's obviously some amount of distrust or lack of trust in the medical system, right? So if you tell a patient, hey, a lady, you tell them, hey, we think you're due for a mammogram, you should have it. Then they're like, well, why do I need it? I'm fine. I'm feeling fine. So you have to tell them why it is in their best interest to do it. And obviously, if you have built some trust with the patient, they're much more likely to listen to you as opposed to, if you're not the regular doctor, right? That is where really the sort of the rubber meets the road. That is enough time being spent with the patient to explain to them why they need something. And then the step after that is also important, right? So say the patient agrees. Now, say they most of the time, these are patients who are on Medicare Advantage plans, right? So it's not as simple as giving the patient an order and saying, hey, go get it done, right? No, first it has to be approved by the insurance company at a facility which is within the network, right? So you have to convince the patient, you have to schedule it, and then somebody needs to let the patient know to make an appointment, and then the patient has to show up, right? So there's a multiple step process, and things can break down at any of those steps, right? So it is not as straightforward as just checking a box, right?
Yep.
Because a lot of things have to happen before a gap gets closed.
Got it. So one part of the problem is just, are you even aware as the provider of what the gaps are? Because if the data in the EMR is not there, it's not always relevant because you have however many thousands of patients on your roster and you can't know them all by heart. And then the second issue is just, is the patient actually doing what they need to do to close the gap?
Are they willing?
Right. In this era of WebMD and ChatGPT and everyone's their own doctor, it can be hard to convince people these things are needed. Okay, that's super helpful. Thank you. So, next question, a bit of a follow up. Like, what are the biggest blind spots you've seen in how health plans or providers approach gap closure? I think you talked about some of that already, but are there other sorts of blind spots you see?
Yeah, as I said, yeah, the biggest issue is the inadequate communication to the patient, like what they need and why exactly they need, right? So if somebody from the office calls and says, we want to schedule you for an eye exam or a mammogram, for example, right? They're like, I don't need it, right? As I said earlier. So it's a matter of communicating with them and explaining to them why they need it. Of course, if it is something critical where a heart doctor tells them they need a echo or a stress test, they're much more likely to listen because now it becomes sort of a life and death issue for them. The screening measures are more difficult. So it's an ongoing, I think, education of the patient that why they need what they need, and as we said, the right data at the right time. So as I said, the health plan a lot of times does not have the most accurate data. So you have to go dig into the EMR and make sure that what they are saying is actually accurate.
Okay, so let's talk a little bit more about, how technology has evolved, right? You've talked about how it's very different the way we close care gaps today as opposed to 15, 20 years ago. Can you talk a little bit about how, technology and clinical teams can sometimes get misaligned when it comes to servicing this data and acting on it?
Sure. Yeah, I think the one area where I have seen this misalignment the most is in medication adherence. I think a health plan finds out if a patient is adherent or not is if they receive claims from the pharmacy. So if they receive a claim for a medication from a pharmacy, they're assuming that the patient is taking it, they picked it up, therefore, the pharmacy is sending the claim. But it's not always as simple as that. I mean, patients sometimes, I'm sure you've noticed this, that if you're on a regular medication, you keep getting new and new, maybe something in the mail, even though you're not due, right? So a patient is not going to go to the pharmacy necessarily to refill it because they already have it, right? In the meantime, the health plan interprets it as we did not receive a claim, so the patient is non-adherent, right? So now they're onto the doctor that this patient is non-adherent. So you talk to the patient, no, I'm taking it. I've had it. I've got 6 months supply sitting at my house, right? So this type of stuff, so I think there needs to be a better system in this whole loop where health plan gets the right data, and then otherwise, people are just spinning the wheels, right? Practice is spinning the wheels and patient is getting upset. Why am I getting these calls? So that's just one example of how, there's some misalignment. And as we said earlier, even, the data is not always accurate, even on these screening measures as mammograms, colonoscopies, things like that.
Yeah, you could envision like wearable devices being useful for stuff like that, right? Medication adherence. Are you taking it? And is there a checklist and a check in on something like that? So, yeah, interesting. I hadn't thought about how, how that is the indicator payers are looking at for adherence. Okay, so we've talked a bit about kind of what the problem is and why it's a challenge. Now let's talk about, what you've done and what you've learned about how you can actually solve the problem, right? And close gaps. So why don't we just start kind of generally? So like what does an effective strategy for care gap closure look like? Can you walk us through like your playbook if you have one, so to speak?
Sure. Yeah. I mean, I think it's, in a sense, it is a playbook, but ultimately it's a multi-pronged approach, right? There's no silver bullet to do it. I think it starts really with, I think your best bet of getting something done is to get the patient in the office and make sure that the provider is ready, has enough time and attention to look at those care gaps, right? That are presented to them, that, hey, these are things that the patient needs, that needs to be discussed. And then after that, there has to be time spent with the patient to explain to them. And then there has to be adequate follow through, right? That the referral is sent to the insurance company and the facility where the test is going to be held, for example, whether it's an eye exam or mammogram, or referral for a colonoscopy. So that has to happen. And I think most practices, larger practices in value based care today, have HEDIS specialists, right? So these are teams that are working really even separately from the providers, right? So making sure that that appointment was made, or if there's, a patient has not come in, but they still have a gap, that maybe you send them a stool local blood kit to their home, right? Just mail it to them and then follow up. So I think at the end of the day, you have to have enough people, the right sort of playbook, and then enough attention paid to it, that somebody is tracking it on spreadsheets or wherever, that, these gaps are actually being closed. And I mean, ultimately, that's where people get to 4.5, 5 stars, is by constantly working it. You have to constantly work it. That's the bottom line.
Yeah, not a set it and forget it type of situation.
Very, very human endeavor. Yeah.
Right, right. And you'd
Yeah.
mentioned some organizations have HEDIS specialists. I was going to ask about that as a follow up. So, like a single physician working on their own out in a rural clinic, let's say, like they don't have that luxury, right? They've really got to kind of see all their patients every day and close these gaps on their own. Have you seen having a dedicated non provider employee, right? Someone who's just doing this work to get the provider ready for the visit. Have you seen that be really useful for the physicians or is it more expense?
Oh yeah, yeah. So let me give you my own example. So my practice got acquired by a larger group 3 4 years ago, but before that, it was just two of us providers in the practice. But we had a lot of these value-based care patients. So we actually had one employee who was just doing this, what we are talking about. So to your point, it was a small practice, but we were making it happen. And frankly, our star ratings were 4.5 and higher constantly, because we were paying attention to it, even more than this bigger group that I'm part of now. I'm very proud of that we were consistently getting all these plaques and stuff from the insurance companies, because we were very solidly in 4.5 and higher.
Wow. Yeah,
Yep.
that's a great story. Okay. All right. So let's talk about some technology stuff. Like what role do you think AI has now and in the future of servicing care gaps? And how do you ensure that what AI is surfacing is actually usable? Right? There's my dad and brother are both doctors, and I'll tell you, if you start making recommendations to them that are not accurate, they will immediately just basically abort the whole process, right? 10% of this is wrong. I'm going to ignore the whole thing. It's got to be perfect for me to use it. So, can you talk to me about where AI could help with this and what it needs to do?
Yeah, I think the use case I have in mind would actually address the situation you're talking about. So I mentioned it a couple of times, that care gaps list or file that you get from the health plans is not always accurate, right? So one thing that can be done using AI is that, okay, so you have this list. Now you run that list against using AI against data that is in the EHR, right? So now you are kind of scrubbing that list in a sense, right? So before the gap actually gets presented to the provider, you've already scrubbed it and looked at all the data that you have and say, okay, yeah, this is accurate. And now you can say, okay, this needs to be closed. So the physician will also have more confidence that, this is not just coming from some random place where I have no idea how they got it. So I think that's a pretty straightforward use case.
Yeah, interesting. So really, in that use case, the AI is replacing that HEDIS team measure person, right? It's doing that job.
Yeah, no, yes and no. Yes and no. So the AI is kind of doing the data mine, right? In terms of, okay, is this a true care gap or not? What I was talking about that, okay, this HEDIS person is working the list, right? Okay, calling the patient, scheduling it, things like that. So both have to exist side by side.
Got it. Okay. So making them more efficient at that job.
Absolutely. Making them and the providers more efficient. Yeah.
Right. Yeah, that makes sense. So can you share with us maybe one missed opportunity that you frequently see in the process and changes you could make to try to solve that one?
Yeah, absolutely. I mean, one that we just talked about, right? Using AI to scrub the data at the practice level, right? But the other one is medication compliance, right? There needs to be, generally speaking, better communication between the physician who is making the medication decisions and the patient and the pharmacist. I see it fairly frequently, right? You ask the patient that, hey, let's stop this medication, for example. So, a lot of times, we deal with a fairly elderly population, right? By the time they've left the office, they've forgotten that instruction, right? So they're still taking it. That's one situation. Second is they have stopped taking it, but the pharmacy still thinks that they are taking it. And obviously the health plan does too. And in the meantime, now everybody's starting to think that the patient is non-compliant, right? But that they were already been instructed to stop the medication, right, by the physician. So that whole communication chain. So obviously the patient needs to listen and internalize that and do what they are being asked to do. But that also needs to be communicated to the pharmacy that, hey, such and such medication was stopped. So certain EHRs at this point have and where you can cancel a prescription that gets communicated to the pharmacy. But from my experience, that's a very much a hit and miss. Where even though I've clicked cancel, and I have to say I'm not great at that. I need to be more consistent. But a lot of times, even when you do hit the cancel, it does not get communicated to the pharmacy, right? So that's just one small example of a missed opportunity. But I mean, I think by now you have a fairly decent flavor of all the issues and why this is not as easy as it seems to be.
Yep, multi-layered onion, like everything in healthcare. It is a tricky thing to solve when you get down into the details. Okay, so let's talk some stories from the field, so to speak. Can you share a real example of a customer of Inferscience who saw a meaningful improvement in care gaps using that solution?
So we have built a solution which surfaces the care gaps that come from the health plan in a sort of a more automated fashion where in the nice little Chrome extension you can see what the health plan wants to surface to the provider. But what we've built on top of that is this ability that we were talking about earlier, that using AI you mine the EHR for the data, and then based on that you can basically show it to the provider that this is a true care gap because we have not found any evidence that this gap is closed or that the patient is not eligible for the care gap. That's something that we've just finished building and we're about to release to the market.
Okay, very cool. So without something like that, you're getting as a provider, you're getting this file from the payer and you kind of just have to manually read through it and then try to figure out in the EMR if that's a gap that needs to be closed truly or not. So you're really helping with streamlining that decision making process, it sounds like.
Exactly.
Okay. So when you've deployed that, how do the clinicians respond when they see something like that, right? That's actually helping them save time in their office rather than interrupting the workflow, which is what a lot of providers complain about in the EMR. What's that moment like?
All clinicians really appreciate things like that, which which is something that is smart and is accurate. Because, as you said earlier, with your family members who are physicians, that the biggest pet peeve is this thing is wasting my time, right? Because this is not accurate. And I have seen solutions even for HCC coding, which are like that. And it really can be a time sink where you are, just spinning your wheels, so to speak. So yeah, we've had excellent feedback for all our solutions from the providers because we have a high emphasis on accuracy of the suggestions.
Yep, that makes total sense, and that's exactly what I've heard in 15 years of dealing with physicians. If you're putting inaccurate recommendations in their workflow, that's that's more frustrating than just having nothing at all in there. So, okay. So, we're just about wrapped up here, but final thought, in your view, how does better gap closure tie into broader goals like health equity or patient trust?
Yeah, I think it very much does because at the end of the day, I think most physicians they don't really care who's sitting in front of them, the patient, right? Whether they're rich, poor, black, white, it makes no difference, right? Hopefully that is how it is. So when you treat a patient, every patient the same, right? And you pay the same amount of attention to all of them, where, okay, we are going to do the best we can for you, where, we are going to do all the preventive stuff so that, if there's something, we catch it early. Or in cases of, for example, colonoscopy, removing polyps, you are actually preventing a cancer, right? So, in that sense, I think it definitely ties into health equity, but even patient trust, right? So, and it will happen over time that certain patients you will find on these screening measures, for example, that we are talking about, whether it's breast cancer or colon cancer or what have you. So the patients do appreciate that, hey, you caught this early, and as opposed to having stage 4 cancer, or even catching something before it got to cancer. So I never got the cancer. So I think there's a massive impact on the patient physician relationship, or even the patient's health system, you can call it, right? Because the system did not let them down, did for them what it was supposed to do. So I think it's yeah, I mean, gap closure, to health plans, and a lot of the staff, even it's about checking boxes, perhaps making sure you get your score up and you get your bonuses. All of those are important, but at the end of the day, you really are helping people have better health and live longer by doing this.
Right. Yeah. I think that's a beautiful point to end on, and we are coming up on time here. So thank you so much, Sunil, for your expertise as both a businessman, a software entrepreneur, and also a physician. You're in a very unique role to have a really interesting perspective on this stuff. And just to summarize, right, care gap closure, it's not just about ticking a box. It's about showing up for the patient at the right time with the right context. So I just want to thank everybody for joining us for this episode of Care Decoded. And if this episode helped spark new ideas for how you approach quality, share it with your team, right? Follow the show, and let's keep decoding care together. Thanks so much for your time.